Hello, and how are you? Welcome to our session on female genital mutilation. And in this session, we're going to focus on the prevalence of female genital mutilation. My name is Winnie Barawa, and this channel focuses on lectures, lessons, and expert interviews in relation to healthcare. So this lesson is supported by the Girl Generation in collaboration with African Center for Coordination of Ending Female Genital Mutilation in Africa and the University of Nairobi. Don't forget to give us a like, leave a comment, and subscribe if you've not yet done so. So let's see which percentage or which population gets affected the most when it comes to the female genital mutilation. We have introduced this class and we've done introduction part. We've defined what female genital mutilation is, the anatomy of the female external genitalia, and the parts that get affected by classifying FGM. And in this class, let's look at the population that has been affected and what the current research says. Keep it with me all the way to the end. So the current research shows that the prevalence and percentage of girls and women who are aged around 15 and 49 actually are being affected with FGM, or rather undergo FGM in Africa, Middle East, and also Indonesia. So there's an aspect that FGM belts span from east to west and the Horn of Africa, and the countries which are highlighted here indicated that they still have high percentages of FGMs. Now, remember, in the practice of FGM, it does not mean everybody will be practicing severe cases of FGM or the severe types of FGM. There are those that measure on the mild, others are doing the type 2s, type 3s, and other communities are practicing the type 4. But however, in all of these, the cases of FGM are happening. So as you can see, this belt is spread out according to severity, and our focus here is the African countries and a little bit in the Middle Eastern countries. So the purple countries, this shows percentages where the prevalence is less than 10%. For example, in Uganda, in Cameroon, there is Togo here, in Ghana, and Niger. But then you find other countries where the practice is coming up, like 10% to 25%. We have countries like Yemen, the Central African Republic, and different countries having higher indexes. Then we have the highest countries with 80% and above, with very many cases reported in Somalia, and we have cases in Djibouti, Sudan, and Egypt. And also in the West African countries, we have Mali and Sierra Leone countries. So this shows you that the practice of FGM is literally spread out, and how prevalent it happens, it depends on the country where it's being operated on. But you can see the severity is spread out. It's not like in a specific belt where it's common or not being practiced. The prevalence of FGM says that currently there's almost like 30 African countries practicing this, and we have other countries like in Asia, Middle East, and even Americans still practicing FGM. So estimated in research is that 4.2 million girls who are less than 5 years undergo FGM cut like annually, while 200 million globally have already undergone this FGM cut. So we need to be very careful, because out of the 200 million, 90 million is cut-in of girls that is happening in Africa, or rather 90 million is women and girls who belong in Africa. So the prevalence in Kenya currently is 15 to 49 years. 49, among the women who are 15 to 49 years is at 21%, which is still a huge number. You can't like overlook this. So it basically means we all have a role to play in ensuring that we end female genital mutilation, or what preferably said as female circumcision. So female genital mutilation in Kenya, or female circumcision by ethnicity, and remember our focus here is among the women who are 15 to 49 years. So we have communities that have high prevalences, while we have communities which is practiced but small amount. However, we can see the worrying numbers being in some of the Nilotic countries like Samburu with 86%, Somalis with 94%, the Maasai community 78%, the Kisis, and basically there's practice in Kenya is spread out across like all the ethnicities, with some being high in some regions and others being low in some regions. Like in the coast, it's still minimal with 2%. However, this does not mean we should not practice. We should not like end it, because look at the others. Like the others in terms of percentage is still high, like 41%. The practice of FGM is basically spread out in different communities, and it depends with the type of FGM that is being practiced. So FGM is a harmful practice, and you do not want to subject anyone's child, girls and women, into this practice, because we shall see in the next videos how the effects of FGM are based on the types of FGM performed, looking at the long-term effects, the short-term effect, looking at the mental health effect of this FGM, including the urogenital effects and so many parts that get affected just by practicing FGM. So it is our role, all of us, to basically end the practice of FGM and keeping our women and girls safe from this. So let's look at the why are we concerned with FGM first. Why should we end this FGM? The first reason is there's no non-medical benefit that is associated with FGM. If it's anything, it is associated with health complications and health consequences. Then FGM is generally a violation and an abuse of the women and girls' human rights. This goes beyond just practicing a cultural practice for the purpose of identity. This is a violation of human rights, and it undermines the rights of women and girls. It also promotes gender inequality, where women and girls don't have the right to make their personal choices in regards to their bodies, and it brings a lot of harm to them in the long term. Then we are told that countries and communities that practice FGM tend to have very poor health statistics, more so when it comes to maternal health, infant health, and the child health. So being a violation of human rights, promoting of gender inequality, and associated with health complications. Part of this is what leads to these cases of health statistics, because if a woman is undergone type 4 or type 3 female genital mutilation, and the opening is closed and they're going for delivery, or they're in labor, majority of these women go through severe complications like type 3 types of tears, where they are not able to be sutured properly, and they have cases of fistulas, which are very bad cases of complications of deliveries or complications of labor. Then we have socioeconomic impact, which tends to perpetuate this vicious cycle of poverty. And then the other bit is it can lead to medicalization, and medicalization has negative long-term effects of human violation. So medicalization means basically we tend to see now as FGM as something which somebody can voluntarily choose to do as a consented practice, and the medical team can come in to actually perpetrate which is not a good thing. So it also ends up violating the expectation of health workers, which is basically unethical, and we are told not to do any. So if you are a health worker and you have been perpetrating the practice of female genital mutilation, just remember that this is unethical, as it violates our oath that we should not do harm. So the government of Kenya also has banned all forms of FGM. So we are therefore encouraged that we do not continue, or we do not encourage this practice in our various communities. So the question therefore could be, who is actually being cut? So in regards to this female genital mutilation, who is being cut? So we're told majority of the time, the practice is carried out among girls who are between the ages of even 0 years all the way to 10 years, depending on the community. So mostly people start out this cut at different ages. It's not cut across like it happens at a particular age. No. Depending on the community, some people initiate it at birth. Some communities can let the girl wait all the way to 14 years. Others actually are subjected at marriage or before marriage. So it can be initiated at 0 years. It can be initiated at adolescent, that is like 14 or teenagehood. And then we have communities which practice at adulthood and marriage cases. So any women can can be subjected to this practice. So basically, we are told the age at which FGM or female genital cut is performed varies with the local traditions and the circumstances, but some ages decrease with countries or the communities. So there are those who practice it at birth, there are those who prefer practicing it during marital ceremonies before the women get married, and there are communities which practice it before the woman delivers. So it varies. It basically not cut across that some will do it at 0 age, some will do it at adolescent or at marital age. It's based on the community beliefs, it's based on the community practices and what works for them. So on emerging trends, so the emerging trends here, we are looking at the current practices that are coming up in our community, and we're being told that people are actually shifting the type. So people are trying to shift from the more severe cutting to a lesser cutting. So communities are trying to feel like, okay, you've said too much, you think practicing type 3 is dangerous, so we are shifting to type 4 now. So communities are trying to shift from type 3A, type 1 and 2, and trying to practice more of type 4, which they feel is less severe and they feel there is less harm involved there. Well, this is not really assured because FGM is FGM and we should stop practicing it in any form or in any cut. Then we have the age shift where people are now shifting to younger age cutting, like instead of now practicing it at adolescent or practicing it at marital age, people are preferring to practice it at a younger age so that they don't get to be known. At young age, most girls are still naive. Most girls still don't know what is happening to their bodies and they don't still understand. So practicing it at a younger age, it means the population that can fight against it is minimized, and so nobody can fight for them. So it's an easy entry point for them. Then there is a shift in the performers. So shift in the performers means there's now a practice, what you call medicalization, where medical practitioners are the ones coming in to initiate FGM practice. So what does this mean? It means now in the community previously there was cutters. They were cutters. And cutters were people given the role to perform the FGM practice. And these are the people who will be called by the members of the community or the families to initiate FGM on their children or on their girls. So now the shift is on the medical facilities where instead of the parent taking it to the cutter, they prefer taking their child to the hospital so that it's done as a minor surgery, mostly done in the outpatient departments. So this shift now makes it hard to fight FGM because it's becoming hard to trace, it's becoming hard to know who performed it because it is done hidden and it's not exposed to the public as what used to be in the previous practices. Then in the geography, cross-border FGM, where we are saying that what used to happen currently is the community would practice it in the community as an acceptable practice, but because of the government fight against FGM, people are going to countries or they're going to communities where FGM is still allowed and the government is not active in fighting against it. So people will cross border, go to another country, get circumcised, and then come back to the country. So you cannot tell when this person was circumcised. So those are the current risks and the trends that are happening with the FGM cases. So we have type 1, which is now shifting to lesser cutting. And then we have the age shift where we have shifting to younger ages. And then there's the performer shift where is medicalization. And then we have the geography where we are crossing border to get FGM in different countries or communities. And then the girl is brought back to the community when the procedure has already taken place. So that marks the end of our second part on FGM part. So you can keep subscribe kindly, share and comment, and give us a like and trust the video. Thank you so much, and see you in our next lesson.